My name's Cami Yeager, and I am the manager of 3 North, which is a medical unit. Patient population on 3 North is majority of medical, but we see pretty much everything under the sun. Medical patients are kind of like a big puzzle. They aren't here for one thing, they're here because they're sick and we have to kind of piece all the things together to try and find out what's wrong with them. It's a really great starting point for many nurses, and you get a really solid foundation.
My name is Elise Vicente. I'm the nurse manager for 1 North. Our main patient population that we support is nephrology. We do have very challenging patient populations. They're very complex, and they are, really kind of frequent users of the medical system. A dialysis procedure area right on our floor. We also care for our end-of-life patient population. Yes, it's tough and it's challenging, but I have learned more here than really anywhere else.
Hi, I'm Erica Yeager. I am the nurse manager for 2 South. It's called general surgery, but we are really more of a med-surg post-surgical. Most of the med-surg units have really participated in our back to the basics, which is kind of focusing on some of those things that are really innate to nursing. So kind of our proactive rounding, checking in on your patients frequently. The thing that really sets us apart is just the vast opportunity. There are no 5 patients that are exactly the same. We see everything but bones, brains, backs, and babies.
My name's Erin O'Neill. I'm the nurse manager of 2 East, which is our ortho neuro unit. We take care of a wide variety of patients. Some of our staff favorites are our total joints, because those patients come in and we get to see rapid progression and instant improving of their quality of life. And then we also take care of neurosurgery patients, which require us to work with a multidisciplinary team to really make sure those patients are supported.
My name is Wendy DeBlackier. I'm the manager for the nursing resource team. We cross-train our float pool nurses to a variety of units. We support the med-surg departments, which there are a variety of those, from a medical unit to a surgical floor to the oncology department. Cross-train our new nurses to the behavioral health departments. Being an NRT float nurse really complements a new nurse's skill set, because you get that to practice your experiences that you've had in nursing school in all those different areas you're trained to.
My name is Jennifer Collins. I manage the 3 East department. The department is brand new. We've been open for just over a year, and our patient population consists of oncology, neurology, and all of our nurses will be certified preceptors, as the dedicated training unit will also be on that unit for all of the residency to do their first orientation weeks there. And we also have the epilepsy monitoring unit. We bring patients in from the community and we induce seizures, see where they're coming from in the brain. We can do brain resections, give them deep brain stimulators, and actually give them some quality of life back. It's really rewarding to see that patient population.
Hello, my name's Eric Kenner, and I'm the emergency department manager. We see patients from neonates all the way up to geriatric. We deal with end-of-life issues, we deal with hospice issues, we deal with trauma, and then time-sensitive emergencies. We have to be prepared and ready for whatever comes through the front door. I look at somebody as a potential candidate that they have to have an element of being cool, calm, collected, be prepared, be a good communicator, have a positive attitude, but you have to be able to go with the flow, because we never know what any day is going to look like.
I'm Lisa Bunker, and I manage the chemical dependency unit. We're under the KBH umbrella for behavioral health. And the patient population, generally, they're going to need a substance use disorder, and then probably a co-occurring of some kind, like depression or anxiety or a bipolar disorder. There are very, very few places that offer what we offer in Idaho, and so we are full at all times. I think the personality traits that probably accompany most of the employees, that really a big heart. They understand that most of the patients that end up on our unit have had really, really difficult lives. I think our unit lends itself to some unique nursing. One of the big takeaways our nurses have is they get to build real strong connections and relationships with our patients.
I'm Brandy Lawhead, and I manage the youth acute unit. And our kiddos usually stay with us about 7 to 10 days, coming in for a multitude of psychiatric mental health reasons. As no little kid is a cookie cutter, so we have to be kind of flexible in being able to continue to try multiple things to find out what's going to work for them. You have to recognize that these are kids that are coming in with trauma and are not your normal kid. Giving them that grace, holding hope for them while they're struggling, and showing them that they can get better. And the reward and payoff of making a difference in a kid's life is pretty darn cool. Fills your cup.
So my name is Katie Barbera. I'm the nurse manager for critical care. Our patient population spans all different kinds of diagnoses. Many of them have some form of organ system failure and need advanced support to be able to help manage that. And this team thinks on their feet and they work really closely together so that our patients get what they need.
My name is Megan Bosworth, and I am the manager of labor and delivery, postpartum, and lactation. In labor and delivery, we do follow A1 guidelines for staffing, which is 1-to-1 ratio, so our nurses get to spend a lot of time with their patients side by side. We strive to provide really high quality care. We do that by working together as a team. In this department, it's all based on teams and making sure our moms and babies are safe.
Hi, my name is Jerry Graham. I'm the manager of the PCU unit here at Kootenai Health. We are a step-down ICU unit with multiple names: progressive care, intermediate care, and we are part of the critical care service line. We have a large cardiac population, but we go beyond that. So patients that are too sick to be on the acute care floors, but yet not quite at the critical care level will be on our floor, or patients that have come out of ICU. We've taken on the additional education and training to increase the competency of our nurses so that we could take on patient population that could be from any other floor. If you're looking for variety and you want to learn and grow in all areas, PCU is a great place for that.